really no point in trying to improve the registration system. So I think that in terms of for the deaf community, the benefits would be that there would be improved information about services that could be made available, whether it be about equipment, technology, support groups, clubs, lip reading classes. If you've got an accurate register, you've got a way of hopefully communicating directly with deaf people, with the deaf community, and updating them with information. There may be information about how to manage a hearing impairment. I would have thought that's quite important for people who are new, who have been deafened, but that's quite important. Regular updates about improved access to services. Information being used to flag up the GP practices. I think that some of your complaints about access to services that you would make today, you'd probably be making the same complaints 20 years ago in some cases. Well, with new technology, we ought to be at the stage now where when you go to see your GP, it ought to be flagged up that we've got a member of the deaf community, and there's no point of receptionists just shouting out your name. So I do think that that's important. Emergency services. I personally do not think it beyond the realm of possibility that if there was a fire in one of your houses tonight, that when that fire engine's on its way, by the time it arrives, new technology should be able to say, we've got some deaf people in this house. Yeah? That may make a crucial difference to the way the fire service behaves. I would like to think the same would apply if an ambulance is on its way. But by the time the ambulance arrives, with new technology in the future, we should be able to flag up we've got a deaf person. And that's going to be important in terms of where you'll get done with. The police. You know, there may well be an incident with the police, and we all know in terms of communication difficulties, all sorts of mistakes are made. And so I think it would flag that up. I think it's important as well, because I'm quite paternalistic about this. I actually want to make sure that when we're dealing with young people transferring from education to college and into the world of work, that we give the same considerations about the transfer to deaf people as we do for people with learning disabilities. Now, deaf people may be very, very intelligent, there may be no problems, but what we want to make sure is that their transfer from one part of the system to another is as smooth as possible, and they're not handicapped by barriers put up in front of them because of ignorance about what their needs are. And lastly, and I'll give you a practical example, I think it's important to know, I think one of the benefits of registration is so that we know who to consult. And I'll give you a practical demonstration. We've had some research done by Manchester University, and this did involve some members of the deaf community, about the needs of BSL users, elderly people who are in residential care. And we've seen the initial report, and we've told Manchester that they must make the recommendations. It's independent of WAC, of the Welsh Assembly Government. But, you know, there are all sorts of considerations here. For example, a lot of people with BSL, or BSL users in residential care, end up being very, very isolated. They're cut off from the deaf community. There are very few members of staff who can sign. Yeah? So what's the answer? Unfortunately, we can't stop the aging process. Some people's needs are such that residential care does become the best option. But how do we reduce the isolation? If we were to build a specialist home in Wales, we probably wouldn't have enough people to fill it at the current rates. And if we built a specialist home in Wales, would people want to move from Anglesey to South Wales or Mid Wales, away from their communities, to go into a specialist home? Possibly not. They may prefer to stay within their communities. So, other options to explore may be doing something on a regional basis. Maybe saying perhaps we'll have one or two residential homes that will have some specialist that will have some specialist beds. Alternatively, of course, we may still have whatever specialist beds we have and staff who can sign. You may still have the person who says, no, I still want to stay in Anglesey. So how do we make sure that they get the care they need without suffering the isolation and all the consequences of isolation around that? Now that's a practical example. Now if we would have a serious discussion about, okay, how do we try to resolve that, then we need to consult. And it's not just about consulting older people who are in residential care now, it's about consulting people who are perhaps in their 50s and 60s who may have to face this prospect, hopefully in 20 or 30 years' time. Hopefully they won't have to face it at all. We all would prefer to die out, wouldn't we? So that's what I'm saying, is in terms of there will be issues in terms of service delivery where I think it's important for us to consult directly with the deaf community, and I think an improved registration system would help that. Okay? I'm apologising to this gentleman, but I keep pushing forward. So. The benefits for local authorities and the NHS should be that they should be able to make more judgments about capacity. You know, what scale do we need communication services, for example? For targeting advice, for looking at preventative services. The key with all services for older people these days, whether you're deaf or not, the key is very much moving towards prevention. That health want to keep people out of hospitals, except for when they really need it. Social services want to keep people out of long-term care until they really need it. All the emphasis is on prevention. But if we're going to talk about prevention, it may be that we need to target the deaf community in particular to make sure their needs are met on that preventative agenda. It's useful, of course, in terms of equipment and technology for us to be able to track it, to be able to give advice about how it's serviced. And we should be able to check outcomes. So the point about registration is that I don't want to force people into a health and social services ghetto. Deaf people don't need to be dependent on social services or health. You need to have access to universal services the same as the rest of the community. But I think the registration would help because it does provide a means of accessing you for consultation and all sorts of things, really. So in conclusion, the system as it stands is not fit for purpose. I think it can be made more effective. I think a more effective system can lead to benefits for you and indeed for organisations. And this is part of a formal consultation. I've left copies of this on the table. All of what I've said is in the DVD, which is signed. And I would like comments from the deaf community by the 1st of January, if that's possible. Yeah? Now there will, as I said, probably be further consultations. The timing may be influenced because there is going to be a white paper published on social services shortly, and that will raise certain questions about the way services are organised. And I think it'll start to raise questions about whether services are offered on a local authority basis or in some cases on a regional basis, which may be more helpful to the deaf community actually. I do doubt the capacity of some of our smaller authorities to be able to cater for your needs. And it may be far better for some local authorities to get together and say, we will provide a specialist sensory impairment team covering a broader area, but you will have access to more expertise, really. So there will be some further consultations to follow. I don't know if there's any questions that you want to ask now.